All joint replacement patients should use cold therapy to help reduce swelling. You should apply cold therapy a minimum of 3 to 4 times daily for 30 minutes at a time. This can be accomplished with gel packs, cold therapy pumps, or even a bag of frozen peas or corn. You do not want to use heat on your operative site. Constipation is the #1 complaint after surgery. Remember to stay hydrated, consume high-fiber foods, ambulate, and use stool softeners, especially while taking narcotics. You should not go any longer than 3 days without having a BM. One of our nurse navigators will be following up with you intermittently for approximately 90 days after your surgery. Please feel free to call one of them if you have any questions or concerns. In addition to these educational videos, you can find a digital copy of the Total Joint Manual online at www.erlanger.org/ortho.